Hey, good morning. My name is Kinsey. I'm a student of physical therapy here at UIMS. I'm going to be working with you today, changing your dressing and checking for infection and giving you a new dressing, if that's okay. Perfect, thank you. Do you have any questions, anything for me right now? Okay, good. How's your pain level before we get started? Is it okay? Good, okay. So yeah, again, I'm just going to be changing everything, getting some measurements to see how we're progressing, making sure there's no infection. If you have any pain during this, let me know, I'll stop. But I'm just gonna get everything ready, okay? And if you have anything that comes to your mind, just get my attention, okay? So, first what I'm gonna do is I'm gonna wipe down my area. Making sure to get the edges of the table all the way around. I'm gonna throw this in my trash bin over here. My laundry bin is right here. Okay, so now that my area is clean, I'm gonna go ahead and I'm gonna spray my pin in my saline solution bottle. And move those over to the clean area. Okay, so now with that done, I'm gonna wash my hands. I'm gonna get my palms, my wrists, my forearms. I'm gonna get every individual finger. Gonna get my nails. Now with my hands clean and everything clean, I'm gonna move everything over to the table. I'm actually gonna set up my towels first and move everything over to the table. So, just move my clean towel. This will be my dirty towel side. Now I'm going to continue to move everything over. Okay, I believe that is everything. Okay, so now with my supplies in position and everything clean, I'm gonna don my PPE. So I'm gonna put on my mask, my protective eyewear. And then my gown and gloves. Okay. Okay, so now I am ready to treat the patient. It's okay. Patient, I'm going to put some towels underneath you. And I'm also going to have another one drape over you for privacy. Okay. And now I'm ready to remove the previous wound dressing. So I'm going to push down on the skin to try to prevent as much discomfort as possible. Okay, I'm going to discard this in the trash bin. And now I'm going to assess the primary dressing, looking for any drainage. I see minimal serosanguinous drainage. I don't note any odor, so I don't, this doesn't indicate any signs of infection. I'm gonna go ahead and discard this. And now I'm ready to clean the wound bed. So using my saline solution, spraying that. Now it's dirty, so I'm gonna put it on the dirty side. And I'm wiping from inside out, making sure to get all of the wound bed clean, disposing of this. So now I'm going to use another gauze. I'm gonna wipe the peri-wounds area, not going back into the wound bed at this point because I don't want to contaminate it. Discarding that. So now that I have cleaned the wound, I believe I'm ready to now discard my gloves, and I'm going to prepare the tape. So okay, put my gloves off. Now I'm going to go ahead and prepare my tape. Okay, perfect. Tape goes on the dirty side now. So with my tape prepared, I'm going to go ahead and put on my second pair of gloves. Okay, so now I'm ready to assess the wound. So it looks like the longest part here is from 11 o'clock to 5 o'clock. And that looks to be 7.2 centimeters. And then the widest part appears to be from 9 to 3, which is 6.4 centimeters. I'll just assess the depth. I believe right here is the deepest part. The depth of the wound is 1.6 centimeters. I'm also going to note any undermining or tunneling I see. I do note some undermining from 12 to 3. So the 12 that undermining is 1.2 centimeters. That 1 that undermining is 1.4 centimeters. And that 3 that undermining is 1 centimeter. I also note some tunneling at around 5 o'clock, 4:30. And the amount of tunneling is 2.1 centimeters. Okay, so now that I've done length, width, depth, tunneling, and undermining, I'm going to dispose of this. Okay, and now I'm going to move on to tissue types. So I see 10% dry black ash scar. I see 10% bone. I see 30% slough, 10, 20, 50, and then I see 50% granulation tissue. Again, I don't notice any odor The peri wound looks overall healthy except for this presence of eschar. Again, there is some undermining and tunneling, but I do not see or notice any signs of infection. Okay, so now that the wound has been assessed and measured, okay, I'm going to now apply the new dressing. So patient, I'm just checking in, making sure you don't have any pain. Okay, great. So I'm at the point, I'm just gonna go ahead and apply the new dressing to your wounds, okay? So again, if you have any pain with this, just let me know. Okay, so. And prior to putting the gauze in, I'm going to protect the peri-wound area with the enzymatic debridement. Going around the area to make sure it's protected and safe. I'm going to dispose of this. So now I'm officially ready to place my primary dressing. I'm going to make sure that this is packed well enough to fill in the undermining and tunneling areas. Okay, good deal. I'm going to dispose of this. Tape. Okay, and now with the new dressing on, I'm going to initial and date. And now that I've used the pen, I'm going to put it in the dirty area. Okay, so do you have any pain currently after all that? No? Perfect. Okay, so I'm just gonna go ahead and get everything cleaned up. So I'm gonna take the towels back since you don't need those anymore. Okay, I'm gonna put those in the laundry. Now I'm going to go ahead and dispose of anything that I haven't yet used. Okay, so some points of education real quick. Your wound looks great, it's healing the way we want it to. Continue to do what you're doing, so drink enough water, get enough protein. I think it would be beneficial to go ahead and set up an appointment with the dietitian for you, just to make sure you're getting the correct amount of nutrition. Also, we're going to go ahead and set you up on a training schedule, so that just means we're going to make sure that you're moving pressure off of your injury site once, at least every 2 hours, okay? Hopefully more, but we're going to tell your family about this, and we're going to tell everyone on your care team about this, so we're all on the same page, okay? Do you have any questions for me? No? Perfect. Okay. So I'm just going to clean up. If you have any questions while I'm still here, just go ahead and shout them out, okay? Okay, perfect. Okay. So now I cleaned everything up that I can. Well, putting this in the bin. And now, extra tape. Okay, so now with everything thrown away that can be thrown away, I'm going to have my assistant untie my gown. Thank you. So now I'm ready to take off my PPE. Great, take off my gloves now. Take off my disposable eyewear. I'm also going to take off my mask. Okay. So now I'm going to Spray down my pen in my water bottle. Set that back on the countertop. Just sanitize my hands again. Going to take my remaining towels, put them in the laundry. I'm going to spray down my area again. Again, making sure to get the edges of the table. And lastly, I'm going to wash my hands before leaving the room. Making sure to get each individual finger, as well as my wrists and forearms and fingernails.